Okay, in this lecture we're going to go over the surgical therapy of glaucoma. This is the 8th chapter in the BCSC section on glaucoma. We'll again probably break the lecture up into sections to just make it easier to go through. Surgical intervention is done when patients basically have failed medical therapy. It's done also when medical therapy is not appropriate or when patients just don't adhere to the medical therapy for whatever reason. It's typically done when the IOP is not controlled and there's progressive optic nerve damage or visual field loss, again after patients have failed medical therapy for whatever reason. It's typically not done as the primary approach except in certain cases such as angle closure glaucoma or primary infantile glaucoma, where the surgery is felt to be curative. The role of surgery versus medical management was evaluated in the CIGIT study, or the Collaborative Initial Glaucoma Treatment Study. And the surgical procedure that was performed is dictated by the clinical setting, laser versus incisional. Okay, so what kind of laser treatment do we have for glaucoma? Well, you have laser trabeculoplasty, which can typically be either ALT or SLT, and this is for open-angle glaucomas. And for incisional types of surgery, you have trabeculectomy, full-thickness sclerectomy, combined phaco-trabeculectomy, glaucoma tube shunts, and now there are a number of non-penetrating glaucoma procedures as well. What kind of lasers do we have? Well, as mentioned, we have laser, argon laser, and SLT. What are the indications for these less invasive procedures? Again, it would be open-angle glaucoma, typically with suboptimal IOP on maximal medications. Now, the glaucoma laser trials show that there may be some benefit to earlier laser treatment, perhaps after one medicine or as an initial treatment. But many people consider it to be premature to offer laser trabeculoplasty as the initial treatment, although it is becoming a little bit more accepted with SLT. My personal preference is to save laser trabeculoplasty as an option after one or two medications have failed to bring the patient under adequate control. The laser trial was a multi-center randomized trial assessing the safety and efficacy of laser trabeculoplasty as the initial treatment for primary open-angle glaucoma. And they showed that within the first 2 years of treatment, laser trabeculoplasty was as effective as medical therapy in controlling the glaucoma. But it's important to note that over the course of this study, more than half of the eyes that initially were treated with laser still required medication. Although it's also important to note that the medication regimens used at that time are no longer commonly used today. They're kind of outdated. But half of the patients still require them. Laser trabeculoplasty tends to be more effective in primary open-angle glaucoma, pigmentary and exfoliation glaucomas. It's less effective in aphakic and pseudophakic eyes, and therefore one might want to consider doing laser trabeculoplasty before cataract surgery rather than after it. The success rate for laser, it generally causes a 20 to 25% reduction in the pressure, and that pressure reduction typically lasts about 80% of patients for the first year, and it declines in about 10% of the patients that have it each year thereafter. So after about 5 years, only about 50